Okay, so this is our room setup. Um, Hopefully that shows most of it. I'll just close this real quick. Boop. Um, okay, let's get this. Oh, yeah, I'm already recording. Okay, so we can start. Okay, knock knock, hand sanitizer. Hello, Mr. Bill. My name is Lauren. I'm a student physical therapist assistant. Today we're going to be doing a high voltage treatment. I hear you've got some infection going in that wound you have on your leg. So this is actually going to work to help treat the infection a bit. It's going to attract different little cells that are part of your immune system. It's going to attract lymphocytes, activated neutrophils. Sorry, I can't talk. And mast cells. These are all cells that help fight off the germs and stuff. So it's going to try and help work on that infection so we can get back to healing better. What you're going to experience with this is just going to be like a little tingly sensation. It's not going to be anything big and scary. It's just a little tingle. So a couple things I got to ask you beforehand. Do you have any implanted devices like a pacemaker? Do you have any history of blood clots or any recent clots? No. Okay. Do you have any neuropathy going on in your legs? Anything that would impair sensation? Okay. Then do you have any history of cardiac disease?
No.
Okay. What we're going to need to do for this treatment will involve some touching of your leg, so repositioning. We're going to be putting little sticky pads on it for a while. Is that okay?
Yep.
Okay. So the first thing I'm going to ask you to do, we're going to, are you okay with laying on your belly? Mm-hmm. Okay, let's have you lay on your belly just so we can have some good access to that area. Okay, so I'm going to put one pillow on your leg because you do have a little bit of swelling in your area. Your ankle. So it's just going to elevate it some. Then we're going to look at the skin, make sure everything's intact and as much as it should be. There's wounds, obviously. But then we're going to get everything cleaned off. And for the wound, we're going to want to have it packed with some sterile gauze soaked in saline. Then we're going to cover that with carbon electrode. We might need something to help it stay in place. You just want to make sure it's not going to accidentally move during the treatment. So now I'm going to apply this one that's over the wound that's negative charge, and then 6 inches up over the gastroc muscle belly. We're going to be putting the dispersive pad. It's a bit bigger. We're going to have this going at a pulse duration of 70 microseconds and then a frequency of 90 pulse per second. For amplitude, we're just going to have to play around with the milliamps until we find what works for him. We want a sensory response to just like a little tingle. And then our treatment time is going to be 2 hours. So let me grab this and see what we can do to show you the placement. Okay, let's sit. Okay, so I'm gonna lift this up a little bit, see if maybe I could get your leg. I don't know, this ain't working very well. But yeah, that's what we got here. Sorry, I'm gonna run into the wall if I back up much more. But yeah, okay. So once he's all set up like that, we want to leave him with a timer and a bell. So if you need anything, you can call me. If If you want to know what time you're at, you can check out the timer. But I will be in and out here to check on you. Just if you're worried about anything, if you need any help, just call me. So then we'll let him lay for his 2 hours. Then we're going to turn off the machine. We'll come and remove the electrodes, making sure that there's no burns, any adverse reactions or anything. We're going to want whoever's in charge of it in this situation to get the wound redressed how it's supposed to be, so it's covered up and we're not at risk of getting a bunch of gunk in there or whatnot, because it's his leg, he moves around a fair bit. So here, we can get you back sitting up, Bill. Here, come, roll over, and then let's bring those legs. So how do you feel like everything went today?
Pretty
Any
good.
questions, concerns? No. Okay. So I will be back again tomorrow. We're just going to be working on the same thing, trying to help your leg clear out that infection so we can get back to healing. So, yep, I'll see you again tomorrow. Okie doke.